Shall we start, Ugo? Yeah? Okay. Good afternoon. It is my pleasure to welcome you to the panel discussion on climate action for health as we jointly mark the first dedicated health day here at COP28. Kuwait Fund, on behalf of the State of Kuwait, is indeed proud to be hosting this discussion and is committed to advancing concrete climate action for health. The State of Kuwait and WHO recognize the importance of building health systems resilience against the negative impact of climate change. Health systems must be equipped with the human capital, data, and technology innovations that are needed to build and sustain resilience, as well as adapt to future climate threats. Recognizing this, the partnership between WHO and the State of Kuwait looks to integrate climate-informed thinking and risk planning into interventions going forward. This applies both to the collaboration nationally as well as the collaboration to support developing countries globally through joint impactful interventions between Kuwait Fund and WHO. And now it's my privilege to introduce our esteemed panelists. Dr. As'ad Hafeez, WHO representative to the State of Kuwait. Dr. As'ad has held several senior positions in the government of Pakistan, including as Director General of Health in the Ministry of National Health Services, Regulations and Coordination. He has also served as Vice Chancellor at the National Public Health University in Pakistan and has held a professorship in the Global Health Department at the University of Manitoba in Canada. Dr. Muna Al-Khabbaz, Head of Environmental Health at the Kuwait Ministry of Health. Dr. Muna is a Senior Public Health Specialist and serves as the Liaison Officer for all environmental health-related aspects in Kuwait. She is currently coordinating the National Vulnerability Adaptation Assessment and developing a Health National Adaptation Plan, HNAP, in Kuwait. We will hear once more about it. Salvatore Vinci, Sustainable Energy Advisor at the WHO headquarters. Salvatore is responsible for rethinking WHO's global approach to ensuring that healthcare facilities have the sustainable energy resources that they need to function. And finally, Mazen Malkawi, Regional Advisor at the Center for Environmental Health Action in WHO's Regional Office for the Eastern Mediterranean. Mazen has served in various capacities within the center since 1988 and has been instrumental in contributing to its growth. Thank you, esteemed colleagues, for joining this discussion on climate action for health, evidence building, energy transition, and system resilience. And with this brief introduction, it is with great pleasure that I invite Dr. As'ad Hafeez, WHO representative to the State of Kuwait, to give his opening remarks, please. Yes.
Bismillah ar-Rahman ar-Rahim. Ladies and gentlemen, Assalamu alaikum and a very good afternoon. I extend my gratitude to the Kuwait Fund for their partnership in co-hosting this event today. COP28 clearly illustrates that at its core, climate action is fundamentally about enhancing the health and the well-being of populations. This is evident as every policy aimed at mitigating or adapting to climate change inherently encompasses a vital health dimension. In the last year, we have seen a surge in the climate-related disasters. The wildfires, floods, heat waves, and so many others, along with the rise and resurgence of infectious diseases globally. These events have not only impacted human health and well-being, but have also strained healthcare systems, compromising their capacity to effectively respond to these challenges. Regions with naturally high temperatures, such as Kuwait, are experiencing unprecedented heat levels. These extreme temperatures could significantly challenge human habitability by the century's end, which is not very far. This situation raises important considerations about the resilience of health systems, their ability to address climate-sensitive health outcomes, to protect our young, most vulnerable and elderly, and the infrastructure needed to maintain health coverage while engaging in climate-responsive actions. Today, it's an unprecedented opportunity for health-centered climate action. I have faith in the commitment and meaningful participation of the diverse actors gathered here in this room to mobilize key action and political support around climate change, climate health priorities nationally, regionally, and globally. Once again, I would like to thank all of you and Kuwait Fund and Ministry of Health Kuwait for helping us and supporting us in organizing this joint session. Thank you very much.
Thank you, Dr. Asad. Thank you, Dr. Asad, for these valuable remarks and for highlighting the important context that we are having this conversation in. And before we start our panel discussion for today, I would like to invite Dr. Ugo Ekpezu from WHO Country Office in Kuwait to walk us through a quick history of WHO's collaboration with the state of Kuwait and how this has set the stage to tackle environmental health issues going into the future. Please, if you could play the...
Can you please play the video?
الطاقة الشمسية لا يتم الاستغناء عنها حاليا.
Yeah, not this one, the one labeled one. Okay, this is not the right video, but in any case, I'll go ahead and get started while we sort that out. Good afternoon, everyone. My name is Ugo. I'm the Resource Mobilization Officer for the WHO in Kuwait. And we thought that before we started the discussions on the collaboration for climate action, we would walk you through very quickly the history of WHO's collaboration with Kuwait and how that has led us to the point and to the discussions that we're having today. And to do that, we thought we would try to answer two questions. The first question is, what are the learnings from Kuwait Fund's collaboration with WHO until now? And the second question is, how have these learnings contributed to the strategic priorities of the Kuwait Fund WHO collaboration going into the future? Now, no, not this one, but as I was saying, so the collaboration with WHO has been structured largely into two categories. First, humanitarian interventions, and second, development interventions. And over the years, we've worked on quite a broad range of interventions and projects that we've been able to collect a lot of data on. And that data is feeding into the conversations that you'll hear today and feeding into what we're planning to do going into the future, which you will hear from colleagues shortly. Now, to give you a little flavor of what these collaborations and what these interventions have looked like, you can group, I'll start with the humanitarian interventions. You can group these under three broad categories. So rebuilding health from natural disasters, safeguarding health during major and complex emergencies, and responding to the COVID-19 pandemic. And to give you a little more context on that, when we talk about rebuilding health from natural disasters, it's examples like the 15 million contribution from Kuwait to support WHO's response to the earthquakes in Turkey and Syria. It's an example. So when we talk about safeguarding health during major and complex emergencies, another example is the 3.5 million contribution from Kuwait Fund to support sustaining to support maintaining life-saving and essential health services in Syria and for Syrian refugees in neighboring countries. And then an example under the COVID-19 support that was received thanks to Kuwait Fund was 9 million to support the COVID-19 response in Iraq. So you can see that on the humanitarian side, there's been quite an extensive range of collaboration, and you'll see in a second how all of that is feeding into what we do going forward. And then on the development front, the big heading or the big work stream that we've worked together on is on strengthening health systems and reducing the scourge of diseases. So just a recap there, or before I give the recap, and two examples of interventions that we've had under the strengthening health systems bit would be Kuwait Fund's support to the expanded special project for the elimination of neglected tropical diseases, ESPEN. Kuwait Fund contributed 5 million to that, which was implemented in 45 countries in the Afro region and 5 countries in the Emir region. So again, quite an extensive project with a lot of learnings, and then also about a 2 million contribution towards halting the spread of measles in Lebanon on different occasions. Now, you know, more than happy to provide more information about all of these, but there are 3 key things we've learned from these engagements. The first is that safeguarding health requires multidimensional action. The second is that humanitarian development and peace-building interventions could potentially share similar infrastructure and resources. And the third is that threats to health are advancing much quicker than the action to mitigate them is advancing. And to give you a little more detail on that, when we say safeguarding health requires multidimensional action, it's about strengthening collaboration across the different stakeholders, but also thinking about ways for non-health interventions to be conscious of their health impact. When we say strengthening the link between the humanitarian action and development interventions, it's about thinking about ways to operationalize the humanitarian development peace nexus, and thinking of ways to strengthen interagency collaboration and coordination on that. And then the last point of the 3 insights, threats to health are evolving faster than action to mitigate them. I will not go into detail on this because we have an expert who will talk about that in a second. So that's what we've done together. That's what we've learned from what we've done. Now, the next bit, which I'll end on, is how this feeds into tackling future challenges. So going forward, yes, that's the correct one. I had a fancy presentation set for you. So going forward, WHO and Kuwait Fund will increase advocacy for the adoption of the humanitarian development peace nexus, and will increase collaboration to mitigate the negative effects of climate change on health. So that is the big context of the collaboration and the work that we've done together, and how it feeds into why we are having the conversation that we're having today, and a little bit of flavor about what you can expect to get out of it at the end. And with that, thank you very much. I'll hand over now to Khaled.
Thank you very much, Ogo. For sharing this historical context of Kuwait Fund's collaboration with WHO. I know how it's hard without your visual support, your fancy presentation, but indeed you have done a superb job. Now, building on this, I would like to also invite Mr. Mazen to share with us his presentation on the dynamics of climate change on health and health systems in the Eastern Mediterranean region.
Assalamu alaikum.
The presentation, please.
Having a health event in the National Pavilion is a very good example. The multi-sectorality of addressing climate change and health is started, and I hope it will continue and be stronger in the future. Next, please. Next. في pointer في شيء ثاني. I'll talk about the regional perspective on climate change and health, trying to explain the health impact of climate change and what we are doing in the WHO Eastern Mediterranean Regional Office in collaboration with the 22 countries of the region.
I think it's on the podium.
One, next please. Yeah, if there is a message that I want you to take from my presentation, we need to act right now. We shouldn't postpone, you know, deciding to take action on climate change and health. I know we need to build evidence, but the action, we started feeling the health impacts of climate change. I'm sharing with you some recent photos of flash floods in Yemen in October, in Libya, the very sad, deadly flash floods, in Pakistan and Iran. Tens of thousands of people lost their lives. Thousands of healthcare facilities were destroyed. Millions of people were left without adequate health services because of the climate change that is not induced even by ourselves. You know, in the region we produce only 7% of the greenhouse gases of the world, but we bear the consequences. We bear the very high cost of health impacts. I'll be talking about the region. We are 22 countries, starting from Morocco in the west up to Pakistan and Afghanistan in the east. About more than 700 million people are living in this diverse region. One of the things that, you know, whenever we talk about climate change impacts, the environmental damage on health is already high, and climate change is not making life easier. You know, in the recent estimates, and we are losing 1 million people annually, premature deaths because of different environmental risks. As I said, we are different in socio-economic indicators in the region. I usually say we have the richest country of the world and the poorest country of the world in the region, but we do have common things: a huge burden of environmental risks, emergencies, and I think you are spending support and extending hand to help, you know, countries in emergencies. And we have a high risk index on most of the countries. Unfortunately, climate change is affecting countries who are not capable, who are not prepared or ready. Trying to understand the different environmental risk factors, in more than 56% of the annual deaths are caused by air pollution. Toxic chemicals are responsible about 11% of the death. Occupational risk are responsible about 11%. Still, in some countries of the region, we have unsafe water and unsafe food. And why I'm bringing this while we are talking on climate change? Because climate change is affecting, unfortunately, all these risk factors. It is increasing the air pollution. It is increasing the water scarcity. Then it's not helping. It's not making life easier. On the contrary, it's adding. These are the countries of the region. And this is the burden of the environmental risks categorized in three main categories: communicable diseases, non-communicable diseases, and injuries. And as if you notice, the non-communicable impact on environmental risk factors is high. Classically, we used to think of environmental risk factors as water supply and food safety, affecting only the communicable diseases, but it's very clear that the injuries and the non-communicable diseases is taking major lead in the region. Two facts about climate change in the region, and in Kuwait could be a very good example. First, in the region, the impact of the climate change, the climate hazards are changing in a stronger and faster way than other parts of the world. In 2022, The World Meteorological Organization estimated or measured the increase in temperature by 1.15 degrees. Sadly, in the region, it was 1.84, which means that we already are exceeding even the target that was agreed in Paris. And also, they are happening in a faster way. These are some of the climate changes that are affecting the 22 countries of the region. Temperature. People in the region will be exposed to higher temperatures for longer time. And when you hear the Europeans talking about heat, they talk about heat waves. And I say, you know, we are living a 365 days heat wave. You know, it is affecting all our aspects of life. Then we need to talk about the chronic impact of heat. And think of it, if the annual average temperature will be increasing by 4 to 6 degrees in some countries of the region, unfortunately, parts of the region will not be livable, you know, unless really measures are taken. As I said, flash floods are started attacking the healthcare facilities. This is in addition to killing people. We are possibly the driest region of the world, and climate change is not helping. The current drought, you know, in Horn of Africa, Djibouti and Somalia people, they have to move their places actually because they want to follow the food. And one of the phenomena that is part of the region is dust storms. You know, the number of dusty days and the frequency is increasing, and we know that dust is contributing to about 30 to 50% of the air pollution levels, which is already high. You know, more than 500,000 people are losing their life prematurely because of the high levels of air pollution. And we know some of those are natural and being amplified by climate change. The rise in sea level also is another consequence that we are seeing, possibly in the Mediterranean part of the region more than the Gulf. But there are some estimates showing that some of the cities of the region, including in the Gulf and the Mediterranean, might be drawn unless proper action is done. And some of the cities of the region, they started actually draining and preparing, you know, for those big events. How we are helping the countries of the region by trying to build the climate resilience and environment sustainability of the health systems, including the healthcare facilities. We have well-known procedures and tools, and I'm glad that a recent framework was just launched last week, trying to address 10 basic areas related to 6 blocks of the WHO system, and 4 categories at the healthcare facility, educating the workforce, trying to handle the energy, the renewable energy, dealing with the infrastructure of the healthcare facilities, and talking about the water supply and sanitation within the healthcare facility. For this purpose, and in October this year, the 22 ministers of health of the region endorsed a resolution, a recent one, for a framework for action for the coming 6 years. This framework for action will try to achieve 5 main targets. First is to help the countries in building the climate resilience and environment sustainability of the health systems. And I'm very proud in Kuwait. We are almost in the final touches, putting the final touches in trying to put the health adaptation plan and make the health adaptation as part of the national adaptation plan. Then another important job to do is to prioritize health and climate change policies. You know, we have the transport sectors, we have the energy sectors, we have the other sectors. For our responsibility is to do the co-benefit analysis and trying to convince them of doing the investments. Then engage the health sector to support climate action by other sectors, improve the health sector's access to climate change funding, and I'm glad that the Kuwait Fund is taking a leading role on this, trying to help on this. And again, build a robust evidence base for policy making. And we are very proud of the exercise that was done recently in Kuwait. We're trying to address the gaps of research by bringing the policymakers along with the researchers. And we're trying now to replicate this exercise in other countries of the world. In that framework for action, we are calling actually for 3 types of activities. One within the health sector, and one with the other determining sectors, the energy, the other sectors, and one with the community. These are some examples of the interventions that can be done within the health sector. For instance, climate change is not a vertical program, and it should never be a vertical program. It is a horizontal program. It should be part of all the related programs at the health sector, be it One Health, be it emergency, be it the... But it shouldn't be within the environmental health department or within the climate change department. It should be integrated along with all the climate resilient health outcomes. There is a need to build the climate-informed surveillance and response systems. We know that in some of the countries of the region, we have very strong surveillance systems, but it's not climate-informed. It's based on the temperature that is moved now. Now, we've seen, for instance, examples that some of the new vectors are moving to the countries. We might see new diseases. We should have an early warning system before. We don't want to wait until the disease reach the country. We want to really have early signs in order to properly manage. Also, we have interventions with the other determining sectors like the water, the sanitation, the energy. The first thing is a comprehensive risk analysis system, trying to understand how climate change is going to affect the different health outcomes. And this has to be done not by the health sector alone. It should be done with other sectors. Once you prepare what we call the VNA, you prepare something called the Health Adaptation Plan, which is how the health sector will be adapting in order to manage those impacts. One of the steps that is usually missing and creating sometimes difficulty, this should be part of the overall national adaptation plan. We are not working alone. We are working along with the other sectors, and good that we are on the national pavilion where all the sectors are represented. We need to compile evidence-based climate change and health profile. This is a very interesting exercise where in one document, try to estimate what the climate hazards going to change in the future, how this will affect the health, and what should you do. And one of also the important interventions that we need to be done is with the community, trying to have the community with your side. Unless the community try to adapt, for instance, the green saving or the green devices, you will never work. We need to have the young people along with us in the policy making. I'm sorry if it was too long and ready for questions. Thank you.
Dr. Mazen, please bring the microphone with you, please. Thank you, Dr. Mazen. I believe now the presentations and Dr. Assad's valuable remarks have adequately set the stage for our discussion on how WHO and Kuwait are working together to address these issues both in Kuwait and globally. With that, I would like to start by asking Dr. Assad, what is the significance of COP28 for health?
Thank you, Khaled, and thank you for organizing this panel, very important panel. As you can see, and as earlier been mentioned as well, that this is the first COP where there is a dedicated health day. That itself speaks of the importance and the requirement for integration of health in the general thinking of climate change is required. So we have, the discussions here, as you already know, are about air quality, about water safety, about food security. All of these have an impact on the health of the populations. So this is the holistic, integrated picture which needs to be highlighted whenever we are talking about climate change, health is an integral part of it. Just to give you an example that my colleague was mentioning in Kuwait, the effect of heat. And WHO figures have shown that in last couple of decades, the number of deaths above 65 years of age attributable to heat have increased by 70%. So just this one figure gives us an indication that how crucial the importance of climate change on health. And then, are we ready? Our health systems are ready to imbibe the impact which these new diseases, the enhanced number of people seeking healthcare, would they be ready for that? That's another area which needs to be discussed as part of impact of climate change. When there would be droughts, there would be floods, there would be other disasters, naturally they would mean that there is more impact and more requirement from the health systems, which need to be ready in coming years for this kind of impact. I'm sure with this COP and the discussions integrated with impact on health, it would help us resource generation required to get the health systems, green health systems in place, not only in Kuwait, but in the whole region and globally as well. So these are some of the important points which I see that bringing in Health Day in COP would mean overarchingly for the climate change and its impact on health.
Thank you, Dr. Asad. Dr. Mazen, WHO has extensive global coordination around environmental health. What are the major challenges that are emerging in the region?
As I said, the climate change and health is coming on top of the already harsh environment that we are facing. It is amplifying, the different environmental risk factors, which we face already difficulty in convincing the different sectors of the importance. Another major challenge is the ongoing emergencies in more than 50% of the countries of the region, let alone, the very sad emergency that our brothers in Gaza are facing. What do you expect to tell, people in Gaza when we talk about climate change, while the whole health system is being destroyed? 12 other countries are facing the same difficulties, and climate change is not making life easier. It's adding actually to the challenge. The competing priorities in some of the countries of the region are relatively developing or least developed countries. And when it comes to very limited resources, where do you want the health people to put their resources? While it is, we can prove it that it's more cost effective to prevent disease rather than wait until you treat the disease, but ultimately the health sector or whomever is running the health sector are politicians, that they want to see the fruits immediately, not wait for another 3 or 4 years. Between emergency, competing health priorities, and the fact that climate change, most of the people say we did not create climate change. We are not responsible for the climate change, and we should be awaiting for resources. And I can say it, unfortunately, some of the resources are being politicized. Although we hear a lot of hundreds of millions of dollars here and there, but when it comes where those resources are going, they are going to some countries, but not on the other. These are some of the challenges. Of course, lack of information might be also classified as one of the chronic challenges that facing several countries of the region.
Thank you, Dr. Mazen, for your very frank and honest response, and for your crisp highlight of the main challenges that are indeed that this region faces. Salvatore, an important part of the discussion on climate change and health is centered on health system resilience. what can you tell us about the role of having reliable electricity in healthcare facilities?
Thank you, and many thanks for organizing this event. I think it's extremely important to talk about this aspect, Dr. Khaled. We released a report a few months ago, WHO together with World Bank, International Renewable Energy Agency, and C4All, and we estimated that at least 1 billion people worldwide are served by healthcare facility that without reliable electricity or with no electricity access at all. 1 billion people. So at least 130 million people are served by healthcare facility with no electricity at all. Even when electricity exists, electricity is often unreliable. Days, weeks, hours without electricity. And this means not only that in that period when there is the power outage, the essential services cannot work, the essential medical devices, baby warmers, spotlight, oxygen concentrator. But this also means that many medical devices that are very sensitive to quality just break. I was in Somalia a couple of months ago and I visited the main hospital of Mogadishu. The director of the hospital told me an anesthesia machine just broke last week because of unreliable electricity. So one, no electricity. Two, even when electricity exists, often unreliable. Even when existent is reliable, often depend on diesel. And my colleagues mentioned the sad situation in Gaza. We have all seen that the healthcare facility cannot work in many cases because the diesel doesn't arrive, the fuel supply chain. So when we talk about electricity, when we talk about relying on diesel, we are talking about the really energy autonomy, energy independence of the facilities, not only about it's not all about clean solutions. We are talking about existence. But even when there is diesel, I was talking with our colleague, with the WR before, the cost of diesel in Yemen is $1.14 per liter. The cost of electricity in Somalia is $1 per kilowatt hour. Often the countries which are the most vulnerable are always the one with the highest energy cost. So it's crazy that we are talking about millions and then billions of commitment, and we are in a situation where we don't have money for electricity in healthcare facility, or the poor countries have to spend more than anyone else. Somalia costing of electricity is higher than Europe. The positive thing in all this is that we have today the solution to change this. Solar system, and I know, Dr. Khaled, you are very attached to this topic. Solar systems not only are fast, can be deployed quickly, are reliable, but over the long term, over the 20-year-old of a solar panel, are much cheaper than diesel, and make healthcare facility energy independent without relying on diesel. So a couple of days ago, I was in another panel and someone asked me why it's not happening. And I don't know the answer. Because it's cheaper, it's clean, it's faster, and we still have children dying because there is no electricity for the baby warmers. So if there are all this commitment here in COP, including on investing more renewable energy, that's excellent. Renewable energy, investing, but let's invest in renewable energy in healthcare facilities so we protect the environment, reduce emission, and save lives. So I really hope as a health community, we really have to push for this. And I really commend the work of my colleagues from region, from the country office, and from the Kuwait Fund. We really need supporters on this, because it doesn't make sense that having the solution available, we still have this solution. So thank you again, and really looking forward to the next steps.
Thank you, Salvatore. Actually, listening to you really makes me wish I could really play back a clip we played earlier this morning about a very interesting project that we have supported in Yemen with UNDP. And it speaks to exactly what you have just mentioned, providing reliable, sustainable, and cheap energy to electrify health facilities. I mean, these facilities, you know, the very basic critical health equipment, health functions, this very reliable source, cheap reliable source, is exactly dedicated for that. And we are very proud of it at the Kuwait Fund because it addresses this critical need in 5 governorates in Yemen. And we hope to actually even do more of that. Dr. Muneh, assessing climate risks and climate-sensitive health outcomes is essential for adapting to climate change. What are the key climate-sensitive health outcomes prioritized by the Ministry of Health to tackle the impact of climate change on health and health systems? And how do you foresee the government of Kuwait working with WHO to improve health system resilience to the adverse effects of climate change in Kuwait?
Thank you for inviting me for this important panel discussion. Regarding the climate-sensitive health outcomes, actually, going back to the literature, and we went through a thorough brainstorming with local experts and with the assistance of the WHO, we came out with 5 main vulnerabilities. The first one was cardiovascular diseases, which is heart diseases, and this is a leading cause of death in Kuwait. We have nearly 12 deaths per day. Half of them comes from cardiovascular disease. Then the respiratory diseases, which is to do with the breathing. And there is more than one factor that is associated with climate change that can affect the respiratory system. For example, the pollen, the pollutants, mold, and so on. They all exacerbate respiratory diseases. The third one was the occupational health. Kuwait and neighboring countries, we have a lot of immigrant workers working outdoors in unprotected environment, let's say. So we need to consider them in our assessment and probably have more policies in order to protect them with what we expect with increasing heat and air pollution and so on. The fourth vulnerability was the mental health. Actually, mental health was quite a new area in the VNA assessment. But we thought in Kuwait, the major cause of diseases and death is the non-communicable disease, not the communicable disease. And the mental health is one of the non-communicable diseases. So we thought we can consider it in the assessment and see if it is related to climate change or not. The last group that we considered was food safety and security. In Kuwait, we have, being a dry, hyper-arid area, we have little local production of fruits, vegetables. So we mainly depend on imported food. With the projected increase in heat, I don't know whether these local farms will survive. And if they survive, we need some sort of technology to protect this area. Even the climate change that will affect other countries, that can affect our food security because we import food from other countries. So if we let's say, protect our farms, then also we need to work with other countries because we import most of our food from abroad. So these are the 5 climate-sensitive health outcomes that we are studying in our VNA assessment. Sorry, what was the second question?
How do you foresee the government of Kuwait working with the WHO to improve health system resilience to adverse effects of climate change in Kuwait?
Actually, WHO had a great role in our climate change strategies. Since the beginning, they were a major motive for us. They started the process. They gave us a workshop to explain the whole process because it's quite a new thing for us. They provided us with a consultant who's one of the best in the world, to be honest, and she's guiding us through the process. All the technical support that we needed, whether from the country office, from the regional office, even the headquarters, they have been all the way there with us. And I think this is part of the continuous collaboration between WHO and the Ministry of Health. So we are really thankful for their role. They are encouraging us all the way. They are trying to guide us, being a new experience for us, this assessment. So we are really happy to have them along our side, and they are providing everything they can, technical support, resources, whatever is possible. And I think this will probably continue in the future for all other areas as well.
Thank you, Dr. Muna. I think we'll have one more round of questions, and then we'll open it for, we'll open it for questions later. Dr. Asad, how is WHO's work with the government of Kuwait being designed to reflect Kuwait's dynamic context? And how is the recent assessment mentioned by Dr. Muna influencing WHO's strategy in Kuwait?
Thank you, Khalid. As you already heard, we have been working together with not only with the Ministry of Health, but other sectors as well, with the Supreme Council, with the Environmental Protection Department, and other stakeholders. Over the last couple of years, very intensively, though this has been a continuing process, but very recently, the development of this VNA, which is vulnerability and assessment, to make things more clearer and to draw a roadmap for times to come. I think this has been a very important collaborative work together with the government of Kuwait. And WHO's role is, of course, to assist and fill in the gaps where required by the government. And we can bring consultants, we can bring the best practices. We have expertise in regional headquarters, and around the world. And that's one of our WHO's strength, to bring it as required by the government. So moving ahead of that, we have very recently finalized our country coordination strategy, which is the 5-year document for collaborating with the government of Kuwait, and regarding climate change, in addition to some of the risk factors which were mentioned, NCDs, hospital sector, making the hospitals more green. These 5-6 areas were identified jointly by a very diverse team of the government, which included, of course, the Ministry of Health, but also Ministry of Foreign Affairs, Ministry of Finance, private sector, and experts. So jointly, this strategy was brought up, and we have now a pretty clear roadmap for next 5 years, in which one of the very leading priorities, impact of climate change on health, focusing on Kuwaiti health systems. So that's one of the strategic areas. We are also helping and working with Kuwait to develop an emergency preparedness strategy, which would be used for any future threats, may it be a pandemic or any other, any other, kind of a public health danger, which would include the climate change impact aspect as well. So these are some of the strategic areas, and at operational areas, we are trying to help develop capacity in the ministry and in Kuwaiti sectors to see these the linkage between the climate change and health. So it's very important to create that awareness, not only in health sector, but outside health sector as well. So we have been conducting joint workshops, bringing in experts, maybe having mutual seminars and discussions. And this is an ongoing process. So we hope that in times to come, we would be able to develop a good strategy, a roadmap for making the health systems green in Kuwait over the next couple of decades. There are targets. Kuwait has very recently announced its commitment to attach in the last World Health Assembly. That was a very major step forward. So these multiple steps, but the eventual aim is to have the priorities of the government of Kuwait at its as one of the leading guidance, and then not only arranging our efforts behind it with the government, but also with other partners in the UN system. Like the previous seminar was with, you were hosting it with UN Habitat, and there are other team players in the UNCT. So it's a collective effort, small steps, but inshallah soon we'll be there. Thank you.
Thank you, Dr. Hafid. Indeed, it's very comforting to know of this multi-stakeholder consultative exercise that they are conducting with the government of Kuwait, and all being under the umbrella of, or being cognizant of the climate action and the climate commitments that the state of Kuwait is embarking on. Dr. Mazen, WHO's Center for Environmental Health Action, working with countries across the Eastern Mediterranean region, and how are the learnings from this region's challenges feeding into WHO's global coordination on environmental health, please?
Thanks. As I said in my presentation, we had a very, very fruitful exercise of discussing what we are going to do in the coming 6 years when it comes to climate change and health, and when it comes to environmental health. In 2017, actually, the Ministers of Health and Environment in the Arab region adopted the Arab Strategy for Health and Environment. Later on, in 2018, it was adopted by heads of states, and that strategy covers the years 2017 until 2030. The strategy prioritized 6 or 7 environmental areas, to be addressed by the different countries of the region. At the same time, also WHO developed a regional and global strategies on health and environment. More or less, we are talking about the same thing. We have priorities of water and sanitation. We have priorities of air pollution, climate change. Again, the challenges range from lack of resources in some of the countries of the region, and lack of political commitment in other parts of the region, for the same reasons that we mentioned. Spending on investing on climate and preventive action, generally speaking, takes some time. And you need to have stable political systems to be there to witness the changes. One of the issues that is not addressed yet in most of the countries of the region, some of the environmental risks are transboundary. And we do not have, unfortunately, transboundary sort of agreements or treaties. In Europe, for instance, they have the Transboundary Air Pollution Treaty, where the countries of the region, they know where are their limits, they know what to produce, they know how much is coming from the other country, and they have rules and regulations. They have, for instance, the shared water resources sort of agreements. If you look in the region, a lot of political conflicts, and that might escalate even to war, because simply we do not have shared water resources, which is strongly linked to the health. We've seen a couple of countries of the region ranging from countries with a lot of water. We know the Euphrates and Tigris, and now only 20% of the flow is going on those rivers, leaving 60, 70 million people without adequate access to fresh water resources. So between the political challenges, the financial challenges, and the political challenges, the preventive action on climate change and health is suffering. But as I said, recently, at the highest political level, the heads of Arab states, they've just endorsed the strategy, which requests actually formulation of national committees representing all the stakeholders, that it's not just the health, it's not the environment, it's all the stakeholders where the different environmental risk factors are affecting health. And we've seen very good examples of national strategies to implement the global strategy or the Arab strategy. Again, some of the countries of the region, what was built in years, was just destroyed by the ongoing emergency. But still, we are doing our effort, and we are very proud that we have now strong partnerships in some of the countries of the region between the different stakeholders, including the Ministers of Health and the Environment.
Thank you, Dr. Mazen. Turning to you, Salvatore. reflecting on these challenges that have been identified so far, what are some of the key interventions that WHO is advocating at the global level?
Thank you, Dr. Ali. We mentioned multiple times, including my colleague Mazen, the importance of intersectoral linked. At the end, when we talk about health, and we talk about air pollution, for example, air pollution, Mazen mentioned before, kills almost 7 million people per year. There are 7 million premature deaths for air pollution, and this is only related to the main diseases, let's say stroke, pulmonary disease, heart disease, and so on. When we talk about air pollution, we are often talking about the same causes of climate change. Tackling climate change means also tackling air pollution. What as WHO we are trying to push, and we work very closely with the regional offices and country offices on this, obviously, is to try to include the health in every investment. When we plan for an investment, when we plan for an energy investment, I can see and I commend really the renewable revolution that I'm seeing then, based on solar and wind, and etc. So when we talk about investment in energy, investment in infrastructure, investment in urban planning, this is not in the head of the health sector, but we can advocate, we can discuss with the other countries, we can promote the choice of investment that protect the health, and especially the health of the most vulnerable population. If we look at the infrastructure side, having infrastructure that are climate resilient, if you look at mobility, if we look at electric cars, again, something that is something that that is a decision that is in other sector, but where the health sector can have a crucial role. That's why we need engagement like this. We need to speak with other sector. We need to make sure that health is considered an asset and is included in all the investment of other actors. Thank you.
Thank you, Salvatore. It's really, sometimes it's very hard to really comprehend how very critical and essential and very obvious requirements that are sometimes missed. And I agree with you totally that every infrastructure project should have a health element, and you shouldn't do one without the other. And with that, Dr. Muna, from a country context, what are the strategic levers that the Ministry of Health expects to see that will facilitate implementation of the findings of the vulnerability assessment that you have just mentioned, as you described earlier, please?
Thank you. At the governance and the strategic or leadership level, Kuwait has announced its commitment to building climate resilient healthcare system. So we will try our best to meet the commitment and be committed to it. The other thing is the committee is headed by the Undersecretary of the Ministry of Health. So it's a high-level representation, and it's multi-sectoral. So there are people from different organizations to have the buy-in from all the sectors in order to have the assessment and then to implement whatever policies come out of it. The third thing is that the assessment, the VNA assessment, will lead to the development of the Health National Adaptation Plan, which is part of the National Adaptation Plan, and I think the EPA has committed itself to implementing all the strategies, whether short, medium term, or long term, to be implemented in the country. Also, we have building capacities. Kuwait is trying to build capacities in the areas of climate change, whether in the health sector or in other sectors. And this is also something promising, which will help us in implementing all the policies in the future. There is also regarding the finance. Kuwait has a strong financial base, and in Kuwait Vision 2035, health is one of the major issues that has been considered by the government, and it will be provided with good financial support to implement all the policies that will improve the healthcare delivery and the quality of the healthcare system. So I think these policies that we will come out with after finishing the VNA assessment, will have all the support from the higher leadership in order to be implemented. Thank you.
Thank you, Dr. Amuna. This has indeed been an insightful discussion, and I hope it has opened the appetite for some questions from the audience. So I think we'll take a round of questions and then we can wrap up. Any questions from the audience?
Thank you very much, Khalid. My question is directly related to the climate action from a global perspective. Don't you see that the capacity need to be built at individual and institutional level, global, from a global perspective, on that climate action? To me, this is becoming a bit of a new concept for decision maker, to feed in the climate action for health as a part of their strategies and policy. So I would like to get your insight of how WHO is working toward that aspect of building capacity on that particular matter, on the climate action. Now, and this is in one respect. The other respect, at a regional as well as maybe I come from Kuwait, so at a country level, don't you see up to today, and I always refer to this issue of the clear gap in the decision making between medical care and health care. And I do meet a lot of doctors, physicians, medical doctors. They keep talking about health in the context of medical care. Do you see this at a global level as well, or it is just specific to my own country or to the region itself? Thank you.
Do you?
Thank you for those two interesting questions. I'll handle the first one. As I don't know if you hear today the opening of the Health Day, unfortunately it took us 28 years to convince the climate change negotiators that health is an issue. We've been preaching, we have been talking, trying to put it on the agenda. Thanks to United Arab Emirates, who really was brave, to put it on the global agenda, and hopefully the coming COPs, health will be a sort of an integrated issue similar to the other issues. From WHO perspective, we developed a lot of tools to help the ministries of health, understanding the climate change and health and trying to build the resilience of the health system. We have developed 3 or 4 courses through the WHO, Open WHO, which are available to the all health professionals all over the world. And those are addressing clinicians, because really in most of the cases we used to preach the environmental people who knows the story, but we started talking actually to the nurses, to the physicians about the possible impacts of climate change and how to handle it. The course is available for free online. Also, very soon we will offer an official training on the WHO Academy, where certificates will be given to the health professionals on climate change and health. One of the important issues that we are training the health professional to be negotiators, because now, in this particular COP, there will be the loss and damage fund. We need to educate the health people, the clinicians, the health decision makers, the policy makers, how to make use of these resources, to understand the language that they are using. Because if you look at most of the global funds that are available to support at least the needy countries, the ministries of health, even they don't understand the language that is being used in the funding. But this is one of the things that for the past 2 years and the coming years, we will be focusing, trying to plant new competencies within the health sector, the negotiation part, the terminology that is being used in the climate change arena.
I'll focus on your second question, and with this one line that no, it's not only restricted to Kuwait, it's a global phenomena, and it's evolving. In some countries, it is exactly like this, and in others, there are stages of development. And then there are some countries where all the decisions, even the medical decisions, are made by non-medical people. So that's the other extreme. Probably the best thing is something in between. So I can empathize with that because I was a clinician in my previous life, and gradually over a period of times, not only myself, but my colleagues, we just had many colleagues from WHO who started their journey as clinicians, but then, kind of evolved in public health. In the region, our countries vary in this journey. Kuwait is now progressing well. There are a lot of good colleagues who had their background, and some of them are sitting here actually, I won't want to name them. They started their journey as clinicians, but now they are very mature public health thinkers. And the role of WHO is, as my colleague mentioned, that we try to do capacity building, expose them to trainings, exposures to different meetings, conferences, so that we have that transformation of thinking, zooming out of medicalizing the healthcare. Let's put it like that. So I hope we are moving in the right direction in Kuwait as well.
I'll just add to the last question you asked, Dr. Khalid. I think it's the Ministry of Health, not the Ministry of Sickness. So we should always promote health. I think one policy can save life of hundreds, millions, while a surgeon, for example, will do 1,000 surgeries, 10,000 surgeries through his life, while one policy can save life of millions. So I think we should promote public health more, and we should give it more weight in the health sector in general. Thank you.
Thank you, Mona. Other questions? Hey?
Thank you very much for this excellent panel. I have a quick question for our colleagues at WHO. We're seeing all the numbers about the huge funds required for the transformation of different systems to more resilient, more sustainable systems. And if we take that very literally, we expect that a lot of budgets, even in countries that are doing really well, might not be able to do that without a large strain on their budgets. So the next part that comes is trying to think more strategically in using the same funding to tick two boxes, basically getting the healthcare that's needed, but at the same time getting the climate action part of the development without really having huge expansion of budgets. So my question is has the WHO seen or had an experience of seeing countries do that in real life and seeing and learning from their experiences?
Thanks, Dr. Muhammad, for this nice question. We've actually did an exercise in Pakistan. We tried to do the health and economic cost-benefit analysis of 6 policies. How much it would cost, what is the health benefit of removing the subsidy from fossil fuel? What is the health benefit from changing Euro 3 diesel or gasoline into Euro 6? And those sort of cost benefits analysis, not just in money term, but also in health in health term, prove that some of the policies are very effective. It's if you see how much you are investing, you'll find that you will recover, the cost in 2 or 3 years' time. And the decision maker was given the choice of the 6 policies that with this policy you will gain this and you will invest in. And then we left it to the policymaker to do it. But I would say possibly you start with the low-hanging fruit, just to make sure that the policymaker believes what you are saying. The major investment could be at a later stage where really you have the policymaker with you convinced. And for instance, just analyzing our case in the developing world, 70% of the carbon emissions are not coming from the health sector itself, it's coming from the supply chain, which means it's not the responsibility of the sector. It's very, very feasible, let me say, I don't want to say cheap, very feasible interventions can put the health sector in a very good position.
Just to add one more point, of course I agree with Mazen on the important point of cost, which sometimes we need to, it's a matter of reallocation of resources. Just if we go back to the concept of electrification of healthcare facilities, we are spending hundreds of millions every year as a health community, as health sectors in diesel. In diesel for electricity, we spend hundreds of millions. You know the data much better in certain countries, also in this region. We were talking about Yemen, we were talking about Somalia. So in the long term, again, if we invest in the solar systems, for example, at the beginning the solar system cost is higher than a generator. But if we look over the 15 years of the time of the solar modules, solar is at least 1/3 of the cost of the diesel. So we think it is a cost, but it's not. We are actually saving money. It's just looking in the medium, long term. We will actually invest solarizing system that at the moment relying on diesel. It will actually free up resources that can be useful for something else. It's just a matter of reallocation. International organizations or government have the budget line for the diesel cost, but maybe don't have the budget line for the capital investment. That's why really innovative and institutions like the Kuwait Fund can be extremely important and really show that this change is feasible. So first of all, it's not a cost, it's an investment. Second, it's an investment that actually will bring you to save money. And just one more thing, because this is a key aspect. We estimated that we need $4.9 billion to provide reliable electricity access to all healthcare facilities worldwide. So if you look about it, it's not a huge amount of money. We are listening on millions and billions and billions for committed. $4.9 billion to provide all healthcare facilities in 64 low-income countries with reliable electricity. Mazen was talking about a low-hanging fruit. I think this is a low-hanging fruit. Thank you.
Okay, any more questions? All right, so in closing, I would like to thank you once again, our esteemed panelists, for your valuable reflections and insights, and to all of you for your collaboration and shared goals in making climate action work better for health. Thank you. دكتور الله يسلمك مشكورة شكرا على مشاركتك.